Discussing colonoscopies may not be the easiest conversation to have, but it's a vital one, especially for black men. Colon cancer doesn't discriminate based on age or status or background, but research indicates it's disproportionately affecting black men, often at an earlier age. That's why it's imperative for us to prioritize our health. Encouraging regular colonoscopy screenings is important, but we need an actionable solution here. That's why I'm proud to advocate for House Bill 2385 in the Senate, which mandates that all health insurance plans cover the cost of these screenings. This legislation eliminates unnecessary barriers for those seeking proactive health. However, it's just the beginning. We also need more healthcare facilities staffed with individuals who understand our community's needs and cultural nuances. This goes beyond simply placing clinics in underserved communities. It involves dismantling healthcare-related stigmas and barriers. Talking openly about health and actively seeking medical advice should be ingrained in our culture. We can't afford to ignore our health. I'm gonna repeat that. Black men, we cannot afford to ignore our health. Regular screenings, understanding our risk factors, and spreading awareness are essential steps. Increasing access to colonoscopy screenings empowers individuals to take charge of their well-being and provides peace of mind through preventative care. This measure, House Bill 2385, will save lives. I want everyone to know that while this coverage will protect every Illinoisan, it's super crucial to highlight the fact that those that are most at risk are African Americans and Jewish people of European descent. And this step that we're taking today will help prioritize the health care of those particular groups, but again, all Illinoisans. So I'm proud to be championing this legislation in the Senate, and you'll now hear from my colleague who spearheaded this successfully in the House, Representative Cyril Nichols. Thank you, Representative.
Cyril Nichols, 32nd District. First, I'd like to thank my colleague, Senator Preston in the Sweet 16 District. He's doing an amazing job since he got here, and he fights for the people, and that's why we all down here. This ideology of this bill, is very close to me in my heart because people in my family, suffered from not getting screenings. And I just Googled this morning that because of the screening process, people over 50, the rate is actually going down 1% as far as being affected. But people under 50, without getting these screenings, they're being affected at 5%. Senator Preston alluded to our health care and the things that we need to pay attention to, right? And removing this barrier of an age, I don't even know where the number came from, but removing this barrier that you only can get a screening or you should get one when you're 50. Well, we know Chadwick Boseman, the actor that played Black Panther, was only 43. This is important. This legislation will save lives. And anybody that disagree with that, I'm sorry. We'll agree to disagree. This will save lives. And we can effectively, as Senator Preston said, start to market. Now we can start to market this way where people will pay attention to actually going to get these screenings, because it's very important. I'll leave you with this. When I got my screening at 50, I was blessed not to have any polyps. But the guys that I went to college with, I'd say, hey, listen, you guys need to do it. Well, 3 out of 7 of them had polyps, and one was really terminal. And thank God he got the screening because he's still here today. But he had multiple polyps. So we have to pay attention to this. It's very good legislation. I'm so proud to be partnered with Senate champions such as Senator Preston to make this happen. This is very important. So we're going to turn this over to Joanne. Probably see more of this than we do. All right, thank you.
Thank you, Representative. All right. Blessings. Thank you, Senator Preston and Representative Nichols. Good morning. Thank you so much for having me today. I am a registered nurse acting on my own behalf today as a private citizen. At this time, I want to first take the time out to acknowledge all nurses and healthcare professionals because it is Happy Nurse Appreciation Week. So thank you all to those in front and behind the scenes advocating for the residents. And so there's been stated stats already here, and I want to reiterate some things. Colonoscopies are extremely important for the early diagnosis and treatment of colorectal cancer, polyps, and other diagnoses that can extremely affect our quality of life, okay, and save more lives. Like Chad Boswick deserves to be here. Our Black Panther, as is referenced, like our heroes here, we deserve, there's young males that are out here that deserve to have a better quality of life, a longer quality of life. So we want to use that opportunity to expand and educate and provide information and knowledge and wealth to others. So the procedure itself is a barrier to care. So if you can only imagine, those of you who are not familiar with the colonoscopy process itself, it does involve a view through your colon, through your anal. So if that's the biggest barrier right there, even having the conversation of why you should have this procedure and then the method of the procedure, right? So that's our first barrier to that. It is recommended for ages at 45 and or above, but as referenced, we know that there's family histories that have occurred, prior to the 45, so it's important for earlier detection to ultimately save. So I'm here today humbly asking, coming before advocating for all residents of Illinois for us to consider passing this bill to remove the financial barrier and require all insurance companies to cover colonoscopies, regardless of if it's for screening and or for whatever diagnostic reasons determined by the healthcare professionals. Currently, for some insurance companies, even for those that do cover colonoscopies, the final payment and or determination is actually determined by the insurance provider. So we want to remove that barrier regardless of zero authorization. I don't know about you, but we would be extremely devastated to get a bill believing that was covered, okay? So we're working hard, we're extremely working out, trying to get the community, especially Black African Americans, to say, hey, come on, get these things done. Here's the education, and it's covered. And then even for those currently that are covered, it's later. So education is definitely needed on both sides between insurance companies, the healthcare providers, and even our patients and residents. So, because not everyone has the knowledge, background, or experience to ask their healthcare providers and or communicate with their insurance companies to get the exact language necessary needed for their procedures to be covered. So in conclusion, I want to encourage us all to advocate for everyone in the state of Illinois, specifically for those that have this barrier to allow for better quality of life and ultimately save lives by this preventive measure. Thank you so much for having me.
Thank you so much. So if there are not any questions, if there are, we're happy to fill them.
Can you reiterate why there would be a disparity in occurrence of colon cancer between races and other demographics?
Studies have shown there are a number of factors. Some of it's lifestyle, some of it's the access to health care. Some communities have a history of going to the doctor. I can tell you that my wife sneezed last week and she went to the doctor. I would have never done that. So I think there are some cultural aspects to this, and a lot of it is also associated with our diets, and it's a lot of genetic. But I think if the nurse wants to chime in on this as well.
Also, I want to add to that trust factors. Not all of them have symptoms, okay? And so oftentimes we are determined when we say something, that's nothing. Like, we need to be aware and earn the trust of the community. And when they come in and say, this is not right, this is not happening, you know, and so for colonoscopy, for these procedures, stuff, some of the symptoms don't show up in the action, like for other people. So we need to be able to have a trust situation from the community and for us. So that's why a lot of, it seems like our African-American males and even females, but preferably, they don't tend to come in because their voices, they don't feel like necessarily are either heard and or they don't feel like they trust for the follow-up and the, you know, follow-through. And as I explained, it's not necessarily covered, so you have the expense there.
So it says obviously in the legislation it has to cover medically necessary colonoscopies. Now obviously, the general thinking in the past has always been once you hit 50, it's always considered medically necessary. But that scale is always sliding. So what is medically necessary, and when you hit, is there going to be, I've been hearing 40 now as a new age. Is that something people should look at? This is more for the nurse, obviously.
First of all, I really want to encourage really encourage everyone to get a primary care provider, okay? That is first, the main thing, so you can get your baseline information so that you're not just coming in when something comes in. So I want to encourage everyone to have a primary care provider and at least go in for an annual checkup, right? So that will be kind of the determination so that you can because if you're just coming in the office, right, as a new patient, we have to do a whole assessment, try to figure out, it's kind of hard to determine that baseline. Okay, so that information is kind of it's kind of hard to answer that one, but it's definitely based off of if you can establish a relationship or rapport with a primary care provider and come in on an annual and or at least, those checkups so that we can do the comparison, so that we can do the research, the background check, establish what is the history. And some of us don't know our family history, right? Like, I don't know about you, but not everybody has that family dynamics to where what your family background is. So it's going to be extremely important to establish that relationship with a primary care provider so that we can get you connected with the expertise in that field.
And to put a finer point on that, medically necessary is going to be determined by the healthcare providers that she mentioned, namely the doctor who see it fit that you may be a good candidate to get the screening.